Hello, and welcome to the SUSLA Safe Return to Work training sessions. We are here today with our healthcare providers who will be providing some information to you about safely returning to work in light of the presence of COVID-19 in our environment. And so the information that they share today will provide you all with the facts. And it's so important that we get the facts so that we can understand how to properly face this coronavirus so that as we begin transitioning back to work, each of you can feel safe and actually be safe. There are a number of things that we're doing here on the SUSLA campus, and we hope that as you transition and our students transition, that everyone will be in an environment that is safe. So I look forward to seeing you back on campus. Thank you and enjoy the session.
Good morning. On behalf of Chancellor Ellis, we want to thank you all for taking the opportunity to view this video and our safe return to campus. I want to thank my team, IT, facilities, finance, as well as Mrs. Rogers' team, marketing, also Ochsner, our partners in our healthcare industry. Also, I want to just go over the procedures that we'll have for a safe return to our campus. Under Dr. Ellis's leadership, we've come up with a dynamic plan we believe that will address all health concerns to returning to campus. Our first procedure is when you come onto campus, you will see checkpoints. We'll have 3 checkpoints here on the main campus, that being the administration building, the new classroom building, and the Jackson building. Upon entering that building, your temperature will be taken by a healthcare provider. You will be given a dated wristband each day to ensure that you have been allowed to come on campus that day. We also have sanitizing stations set up at each entrance in each building to provide an extra measure of safety for our students, faculty, and staff. We also have disinfectant wipe stations. Those are really located in the labs and also common areas. So each student or faculty can feel safe and wipe down their designated area upon arrival. Also, we have personal protection shields. You'll see those throughout the campus, mainly in the common areas such as financial aid, IT, and admissions, and also in the classrooms for our professors and instructors. Each room on campus has a capacity sign that designates how many people should be in that room at one time. UPD, University Police, will be monitoring the campus to make sure that we're complying with the capacity signs, that we're complying with our friends and visitors who come on campus, that make sure that everyone is checked in so we can have a safe environment. We also have our social distance stickers. They're located in the chairs in the classroom and in the auditorium. We have floor signs that are located throughout the campus in the common areas and in the elevators as well. Just as a reminder for everyone to stay socially distanced to keep us all safe from COVID-19. Also, we have increased sanitizing of our common areas. Anywhere students or faculty gather, we will be cleaning that area in an increased frequency. We also have what we call a health floater who will be roaming the campus, going from building to building, wiping down, sanitizing all touch points, doors, stairwells, the elevator, things such as that. The last thing we have is a third-party cleaning company. This company has EPA-approved cleaning disinfectants that kill COVID-19. So we think we have provided a safe and healthy plan for all of our students, faculty, and staff to return to campus. This vision is from Dr. Ellis, and we appreciate his leadership. And the last thing I have to say is just mask up SUS. Our next presenter will be Ochsner, our health partners. Thank you.
Good morning. As I am safely separated from everyone here, I'm going to take my mask off for the purposes of this discussion. My name is Dr. Paul Crawford, and I represent Ochsner LSU Health System in North Louisiana. I'd like to thank SUSLA for the opportunity for us to be here and to have participated in a survey earlier this year to help guide everyone here safely back to school. The purpose of our talk today is to inform you a little bit about what the COVID virus is and what it does, and to talk about the safety measures that are being put in place for everyone here to return and to be safe. So we're going to talk a little bit about COVID. We're going to talk a little bit about prevention measures and what works. We're going to talk about the protocol that's been developed for your organization, and then we'll have some questions and answers about what does phase 3 mean, and some other questions and answers that are for us to discuss. So COVID-19 is a virus, and everybody is pretty familiar with what viruses are. They're the smallest living microorganisms that we have on the planet, and they have one purpose. They infect cells and hijack the cell's mechanisms to reproduce. So COVID is a virus that attacks cells in the respiratory system, specifically in the lung and in the nasal cavity and in the olfactory sensation area, which means that one of the first symptoms you have when you get COVID is that you lose your sense of smell. COVID has an incubation period of 2 to 14 days, which means that once you're exposed, that's how long it takes before you begin to develop symptoms. During that time, when you do not have symptoms, you are probably infectious. We don't have a way to detect whether a certain person at any given time is infectious or not, and this leads us to the use of the mask. And we're going to talk a little bit more about that a little bit later. Also, you may not test positive immediately after exposure. So if you are exposed to someone with COVID, we don't really have a way to test and see if you are actively shedding the virus at that time. If you get ill with COVID, you'll have a fever, cough, shortness of breath, loss of sense of smell. These are the most common symptoms. Many people will have almost no symptoms. Many people may have an achy day, as you would when you get the flu. Many people may just lose their sense of smell. The symptoms vary from person to person, just as it does with any other illness. However, individuals who have underlying chronic conditions, individuals who are over the age of 65, are at particular risk to get the more serious complications of this infection. It can happen at any age. People as young as children have perished from COVID, and this is why we try our best in this country to keep from spreading it around. COVID is spread through respiratory droplets, which is the purpose for masking, just like common cold is. Close personal contact, and the recommendation is that you're in close personal contact with someone for more than 15 minutes within 6 feet who has COVID, you are at risk. The COVID virus survives on surfaces. Therefore, if you are in a room with someone who has COVID, and you touch objects in that room, you can spread those to your face by touching your face, which is another benefit of masking. So I'm going to turn things over to Emily Robert, one of our infection prevention specialists from Ochsner LSU Health System, and she is going to fill in a little bit on what really works and the recommendations that we currently have. Thank you.
Hi everyone. Since I'm distanced, I'm going to go ahead and pull that mask down. Good morning. I am Emily Robert. I am one of the infection prevention specialists from Ochsner LSU here in Shreveport. Thank you to SUSLA staff and faculty for partnering with us to help us get a great start back to this school year, and to partner with you to further enhance health and wellness on your campus. So to follow up from what Dr. Crawford was speaking about, we're just going to talk about what we have found that actually works to help prevent the spread of COVID. Biggest thing, I'm sure we have all seen this everywhere, is the big wear your mask signs. Wearing your mask, a cloth or surgical mask, protects others from your germs. I know kind of when this all started, everyone thought, oh, I'm not scared, I'm not going to wear a mask, but it's not about protecting you as much as protecting others from your own germs. Like Dr. Crawford said, you can be asymptomatic for a few days and shed the virus, before you get sick, or you could be asymptomatic and have the virus the whole time and never know. So just wearing that mask really prevents the spread of those germs. Also, cover your coughs and sneezes. Even if you got a mask on, it still doesn't hurt to cough in your elbow, like we've started teaching the pre-K and kindergartners now. So always a good lesson. And another biggie, wash your hands. So Dr. Crawford spoke about how the virus can live on surfaces. So in addition to the sanitizing, if you need to open a door, if you need to touch something that someone else has touched, before you to touch your face, touch anything else, get those hands clean. If you don't have access to a sink, alcohol-based hand gels work great. Just make sure your hands are wet enough to stay wet for 20 seconds. Let them dry good, and then you're good. 20 seconds also is the rule if you have soap and water. Gloves are not a substitute for hand hygiene. Gloves are really to be used in the medical setting when you are taking care of someone who is positive with COVID. If you use gloves in public and touch things, it leads to a false sense of security sometimes, and people start to feel a little bit invincible and not realizing how much they're actually just moving the germs around. So like we said, disinfect the high-touch surfaces frequently. Avoid sharing supplies, pens, utensils. I know college-age students tend to live together, live in dorm environments, apartments. So we're just going to have to work really hard to be diligent about having our own things and kind of keeping things a little more separate during this time. And also use single-use items when possible. We've seen this a lot in food service. A lot of places have switched over to single-use packets for things and silverware type stuff. Stay home if you're sick. So this virus is difficult. It can land you in the hospital, or you can barely know you have anything. So our advice and CDC's advice is if you have any of the COVID symptoms, any kind of stuffiness, snottiness, cold, a little bit of fever, even if you just think, oh, this isn't bad, this is probably just allergies, we are encouraging everyone to get tested. I myself have known several people who, if it hadn't been for this outbreak, they would have just kept on going thinking this was allergies. It's very surprising how many people with really mild symptoms are positive. So get a test. Most tests are coming back within 2 to 3 days, as well as some facilities have rapid tests. And isolate yourself from others until you receive your test result and you receive further instructions. Isolation versus quarantine is another question that we get asked a whole lot. So isolation refers to if you are sick or if you have tested positive. That is when you keep yourself from others who are not sick. The quarantine definition comes in when you have been exposed to someone who is COVID positive and you are spending your 14 days of quarantine from that time of exposure. You may never develop symptoms, but that is your quarantine period to make sure that you are not going to shed symptoms and spread it to someone else. COVID safety protocol for SUSLA, I'm going to go just quickly over a few of these because Dr. Piggy's mentioned a lot of this. So Ochsner, a team, myself and Dr. Crawford and some others from our hospital came to campus back in May, toured a few of the buildings, kind of looked at some hot spots, places where a lot of students and faculty and staff tend to be, and just tried to offer suggestions on how to safely manage everyone. He mentioned the 3 temp check stations. Also, there should be a holding area for consults if there is a student that comes in, or a faculty member or staff coming in with a fever of 100 degrees or greater. Just a little area to kind of figure out what the next step is from there. Next step should be to recommend to go to a medical facility and get tested. There are several nearby Ochsner facilities. I believe the closest is our urgent care in Bossier. We also have one in Shreveport, and also there is the hospital with the emergency room should the symptoms be bad enough to need that. Masks required on campus. Seats spaced 6 feet apart. I see we're doing great in here with the stickers, kind of every other chair. He mentioned the hand sanitizer stations at key points and doorways and near elevators. The cafeteria should be switching to grab-and-go items and single-use items. I believe they're not going to be having a hotline. And limited elevator occupancy and the clear plastic barriers that he spoke about. Sometimes spacing is just not possible, but you have that barrier to prevent your respiratory droplets as well as the other person's respiratory droplets from spreading. Our education plan. So with this partnership with Ochsner and with SUSLA, it's going to continue throughout the year. Monthly, we'll have a little education series. We plan on touching on several different topics other than COVID. Hypertension, diabetes, obesity, and women's health, just to name a few. Like we said, we don't want to just be safe from COVID. We want to increase health and wellness all around. All right, and Louisiana is in phase 3, and this is asked, we've got a lot of questions about this. It is not a lot different from phase 2, the best we can tell. Looking at the Louisiana Department of Health website, I got these few little details for you. So businesses were at the 50% capacity. Now they can be at 75% capacity as long as social distancing can be maintained. We still have the mask mandate. Mask mandates are still in all public places. Sporting events are now opening up, but they are only at a 25% capacity. And we are still encouraging the high-risk population to stay home as much as possible, those with severe underlying conditions, and people who are older in age, and also babies. We're trying to keep them home too. All right, and the next part is going to be Dr. Crawford and I will answer some questions, any questions that you guys have. Thank you.
I have a question. There's been different reports coming out about the 6 feet. They're saying, you know, at one time, make sure you're 6 feet away from someone. Now they're saying that it's a little bit, things may go further than 6 feet. Should we keep it at that distance, or should we be concerned with keeping more space, even more than 6 feet between us and someone else?
Right now, the CDC is our main guidance for things like that, and we're still at 6 feet. I checked this morning. I check their website every day or two. So, you know, this is a fluid situation. We're learning new stuff every day. You know, if that recommendation does change, we just got to roll with it. But right now, they're still recommending 6 feet. So, if you want to protect yourself more, I mean, you know, do what makes you feel safe and comfortable.
Some of the recommendation is based on studies that show how far do droplets go during normal conversation without a mask. If you sneeze or cough, you're going to shed droplets much further. If you are wearing a mask, they're not going to go as far. And if you're not wearing a mask, they're going to go a distance, but it's just going to vary from person to person and individual. And 6 feet has been this recommended by the CDC as the distance that is least likely to result in too much contact.
Good morning. I have a question. It says, what happens to students, staff, and faculty if they do not wear a mask? And I also wanted to add, like, for instance, people like me and the young man in the back that has severe asthma, is it okay to wear the protective shields that you put on your face, or do you just require us to wear masks? Because sometimes because of our asthma, the masks get really hot. So are the face shields recommended?
The masking is recommended. Face shields are not going to be as protective against either someone with COVID spreading the virus or decreasing inhalation of particles that might be suspended in the air for the person who's wearing the mask, who's not wearing the mask.
Thank you.
As far as what will happen if someone on campus is not wearing their mask as instructed, that's going to be up to the administration leadership at that campus.
Okay, I have a question, and actually 3 parts to my question. Kind of goes in line with the question about health issues. We do have a lot of senior citizens. When I say senior citizens, I mean those 55 and above, perhaps, that are staffed here. What would be your recommendation for those people? Also, can you possibly get COVID again after having it? Just want to get some information about being reinfected a second time or even a third time. And last part of my question is if student, faculty, or staff member tests positive for COVID, what disinfectant measures would be necessary?
So to answer the second part of your question first, we don't know the answer to that as to whether one can get reinfected after initial infection. We're currently using plasma from patients who have been infected and have developed antibodies to treat patients who are very ill. But the question of whether or not you can get reinfected with COVID at a later date has not been answered. What was the first question? I'm sorry.
Had to do with senior citizens. We
Yes,
have a lot of those that are staffed here.
And again, to reiterate, we have to be careful. I'm in that category. And I go to work every day, and I'm very diligent in wearing my mask unless I'm in my office by myself. I'm diligent in not touching my face. I'm diligent in washing my hands and using hand sanitizer. And that's what you have to do.
And I wanted to know about the disinfectant measures that we need to take should one of our students, faculty, or staff be tested positive. What kind of disinfectant measures would you recommend once we find that out?
If it's presumed that the student was actually at the facility during the time where they would be infectious, any areas where they were known to be just need to be cleaned. Surfaces in the area need to be cleaned with any EPA-approved disinfectant. And it's also, if possible, you might have to help me with this one. If the room could be empty for, what is it? There's been a recommendation on that. I believe it's 2 days,
72 hours.
72 hours. So if it's possible that the room, if they were in a classroom, if that classroom could be left empty for 72 hours, that allows the virus time to die as well, but still would need a disinfection.
Good morning.
Good morning.
Under the leadership of Dr. Pegues, we've been doing an outstanding job with prevention. My concern is housing. If you look at the news, most colleges' breakouts are coming from the housing area. What could we do here at Southern University extra to prevent a major outbreak in our housing?
I agree that is going to be the trickiest part of any this age group in general, whether or not they're in college.
The administration here has been very proactive in getting ready for this. And part of their plan is, I'm sure, has included what steps are going to be taken in those dormitories. And I don't have the answer to that personally, but I do know that they are proactively investigating this and have looked into it. They called us in May. They called us in May to come do our initial assessment. They're really looking out for their students and their staff.
Another key is just to continue to educate the students. Something just from my recollection of college years, we shared a lot of things. We shared a lot of space, and just the kind of constant daily reminders. Hey, don't forget to use your own set of silverware, or your own set of toiletries. Just kind of really reiterate that we can't share like we used to. And I mean, I know there's probably people living in the same room, but maybe we could, sit a little further away on the couch, have hand sanitizer, located a little more around your apartment or your dorm room, so.
Allow me to address, piggyback on those answers to those questions. Here at the university, we have taken measures in reference to the last question that was asked, in reference to when we find out that we had a COVID case on campus, that space, that room is disinfected by the third-party company with EPA-approved cleaning materials or disinfectants. It remains vacant until that company comes. So we go over the 72-hour recommendation of keeping that room vacant. In reference to the students in the dorms, they should be following the social guidelines that we put in place here under Dr. Ellis' leadership, as well as in the cafeteria where we've provided the grab and go, as Emily mentioned as well. The seating outside, they're welcome to sit outside, and that spacing is 6 feet apart as well. And in the dorms, they have guidelines in the dorms where they're supposed to stay 6 feet apart and one per room. And those guidelines are there for them to follow. And as Emily said, that age group is difficult to keep them from gathering, but we're going to do everything that we can. And Student Affairs has done a great job with a policy in place for those students to abide by, and actions will be taken for those who are not following those guidelines, because we want to keep everyone on our campus safe, and it starts with everyone has an input in our safety. Next question.
Yes. Dr. Crawford, back in April, they stated that the COVID will die off when the heat comes. Now the summer came by, now it's fall. It hasn't went anywhere. So what do you recommend on the time that we should be safe, with the COVID being here and when it's leave?
I have no answer for that question. And how long will it take for COVID to get to the point where it doesn't affect our lives anymore? I have no answer for. That's going to be tremendously affected by whether or not a vaccine is developed.
Thank you.
Yes, sir.
Any other questions? We have one other question.
I have one more question. It's not on the paper, but since we're approaching the flu season, pneumonia season, colds and all that, how do you distinguish the symptoms from those three things to the symptoms of COVID? And what's your recommendation if someone, do they still go get their flu shots, their pneumonia shots, and still get tested for COVID? What is your recommendation?
The answer to the second part of that question is definitely get your flu vaccination, definitely get your pneumonia vaccination if you're in that age group that it's indicated for. The ability to tell the difference between the three infections, colds, flu, and COVID, initially, based just on symptomatology, is virtually impossible. I mean, it could be either any of them. Fortunately, we have testing for both COVID and for flu. So you should see your healthcare provider, and based on their evaluation of you, to make a determination whether you should be tested or not.
Thank you.
I have a question. If you're a faculty member and you're in class and your students are in class and you believe someone is exhibiting signs, someone in your class is exhibiting signs of COVID-19, how do I what are your recommendations for me to that person and for keeping myself and everybody else safe? how do I direct that person to get help? And what measures do I take to keep my other students and myself safe if I see someone exhibiting the signs?
Let me take that. We have a virtual clinic that will be set up with our health partner, Ochsner. You can recommend that that student, staff, faculty visit that virtual clinic, which will be located in the Welcome Center of the administration building. There, they'll have a private area where they can speak to an Ochsner representative in reference to their symptoms and Ochsner will provide them further guidance of next steps to be taken.
In regard to the safety in the classroom, follow the guidelines. Everyone should be wearing a mask. And if you are suspicious of that, perhaps it would be appropriate to ask for an independent cleaning of the room afterwards until the diagnosis is confirmed.
Thank you.
Now, I do have another concern. Some gatherings are, I would describe them as perhaps unavoidable, particularly with our student athletes. We have a lot of them on campus, live in the dorms. And when they're gathering for competition or even practice, of course they're not wearing their masks. They're exposed to their other teammates. And of course, as a public safety professional, I'm going to be in a situation where my staff are in constant contact with the student population. So I do have some concerns about testing. How often should we be getting tested? Is it something that we should do once a week? And what kind of preventative measures are in place to assist those of us who, based upon what we do on a daily basis, are not going to be able to avoid contact with people, particularly on a continuous basis.
I can say the policies that we have in place, Chief, wearing the mask, staying socially distanced. For the football team, that's another area of concern I know that you all have. We'll look at the policies that they have in place in reference to keeping their social distance when possible, and when playing, what other measures they need to take into consideration, as well as the testing. We'll have to refer that to student affairs on the testing of the football team. And remember, the football team is an independent party of the university.
I would just add to that, just be sure to really educate those people in those situations, the players on the teams. Just speak to them. They are with their group, their same group of people that they see and play their sports with without their masks, but then everywhere else, they've got to think they're taking all these people's germs with them. So that's just going to be a group of people that's going to really need to be very responsible about keeping that mask on in all the other times that they are with others. Because if someone in the team, turns out to be positive, they know, hey, these are the people that we know to check out, to be, on the lookout for symptoms and to quarantine. Then you don't have all the extra people, to worry about that might have been exposed.
Thank you all for sharing your time and giving us an opportunity here at Southern University Shreveport to allow us to educate ourselves and you on our safe return to campus. We want to thank our partners, Ochsner, LSU Ochsner, Dr. Crawford and Emily, for coming out and sharing their expertise, knowledge as well. And we look forward to the return to campus. On behalf of Dr. Ellis, our Chancellor, we want to welcome you back to a safe and healthy environment. And we are concerned about everyone's safety, and we'll be taking these measures very seriously as we're following CDC guidelines and also the advice from our experts at Ochsner. Thank you so much.